Hello, wonderful people. Welcome to Nurse Life TV. So, in this video, I just share some apps, NCLEX apps that I used whilst I was preparing for my NCLEX. When I was at work and I don't have time to look at my flash drive or don't have time to look at my book or go on YouTube at that moment, and I just want to practice, this is one of the NCLEX app that I downloaded on my phone and I was using. It says Ultimate 8 app, NCLEX-RN. NCLEX-RN. You see this? I hope you can see it. So it has the flash drive, it has the flashcards, and then the take quiz. So let's say take quiz. You see, it has adult health, it has child health, it has fundamentals. These are heavy questions in the NCLEX. Okay, so let me go to fundamentals. So they have the fundamental skills, the developmental stages, laboratory values, fluids and electrolytes, acid base. Okay, so let's do fluid and electrolytes. Let's see what comes up. A client has an order for arterial blood gas ABG analysis on radial artery specimens. The nurse ensures that which of the following has been performed or tested before the ABG specimens are drawn. So you go through this, and then if you choose the wrong one, it tells you incorrect and then let you know the correct one. Now let's see the rationale. Before radial artery puncture for obtaining blood sample for ABG analysis, an Allen test should be performed to determine adequate ulnar circulation. Failure to determine the presence of adequate collateral circulation could result in severe ischemic injury to the hand if damage to the radial artery occurs with arterial puncture. The Babinski reflex is checked by stroking upward on the sole of the foot. Holman sign, calf pain on dorsiflexion of the foot indicate the presence of deep vein thrombosis. Brodinski sign is nausea rigidity on bending the head down toward the chest. Exam strategy. Use the process of elimination and think about the purposes of the test identified in the options. Recall that the purpose of Allen's test is to assess the adequacy of ulnar circulation. Review the Allen's test if you had difficulty with this question. So it tells you what kind of process you should use so you can eliminate the bad ones, and then you see clearly which one is the good one. You understand? So this is an amazing app. This is for free. I do not pay anything to have this app to learn. Okay, so next question. A client is diagnosed with respiratory alkalosis induced by gram-negative sepsis. The nurse carries out which of the following prescribed measures as the most effective means to treat the problem. A client is diagnosed with respiratory alkalosis. Okay, so respiratory alkalosis, we know that the carbon dioxide is low because the person is breathing too fast. Anyways, let's see. Administers prescribed antibiotics. Administers antipyretics as needed. Has the client breathe into a paper bag. Request an order for partial rebreather oxygen. So I will choose the C because a partial has a client breathe into a paper bag. When they do that, they are able to retain the CO2. So let me choose C. It says incorrect. Administer antibiotics prescribed. Well, we are talking about sepsis here. So sepsis, in other words, the person has what? An infection going on. So let's see the rationale. The most effective way to treat acid-base disorder is to treat the underlying cause of the disorder. In this case, the problem is sepsis, okay, which means the person has infection that has gone systemic. The entire system is in the blood, which is most effectively treated with antibiotic therapy. So antipyretic will control fever secondary to sepsis, but do nothing to treat the acid-base balance. The paper bag and partial rebreathe advance will assist the client to rebreathe exhaled carbon dioxide. That was what I was thinking, but that's a secondary issue. But again, these do not treat the primary cause of the imbalance. So exam strategy here, it says note the strategic words sepsis and most effective. So there are key words that you have to be looking out for in the NCLEX questions. Okay, there, look for the keywords so it can help you eliminate. So one keyword is sepsis, and then the next keyword is most effective. Recalling that the most effective treatment of acid-base imbalances involve treatment of the primary cause would direct you to option 1. Also recall that the sepsis is a systemic, that's what I just said, systemic infection, and is treated with antibiotics. Review the treatment for respiratory alkalosis and sepsis if you had difficulty. Okay, so let's see the next one and I'll end my video. A nurse is assisting in performing an arterial blood gas analysis on a client. Which of the following is an appropriate nursing action after the blood specimen is drawn? A nurse is assisting in performing an arterial blood gas analysis on a client. Which of the following is an appropriate nursing action after the blood specimen is drawn? Cover the site with 4x4. Apply warm packs to the site. That is unnecessary. Perform passive range of motions for the fingers. That's unnecessary. Apply pressure to the site. Let me tell you why I chose that one, apply pressure. So immediately you take blood, the probability that it can be bleeding is high. So you want to apply pressure so you can stop it from bleeding excessively. Okay, so let's go and see the rationale. Pressure should be applied to the site after arterial blood specimen is drawn. The blood pressure in the arteria is higher than in the veins. So applying pressure to the puncture artery is necessary to control bleeding. That's what I say. You want to control bleeding. Covering the site with gauze may protect the site, but would not control bleeding. Heat by application of warm packs causes vasodilation, which would increase bleeding to the site. Exercise would increase circulation to the area. So exam strategy. Use the process of elimination, noting the strategic word arterial in the question will assist in directing you to the option that. So when I get time, I'm going to make maybe a series of videos about strategy of answering NCLEX questions. Okay, when I get time, I definitely, if you are in an LPN-RN program, I strongly encourage you to get these apps, the RN, NCLEX-RN apps, which are free. Don't do any paid version, free versions. Every day, answer questions on these apps, and it's going to help you. This is one of the strategic way of learning when you are in nursing school, especially in an accelerated program. Thank you for watching. Another one of, let me see if I used to have about 3 of the apps. So this is one of them. And let me see if I can find the other one. Let's see if I can find the other one. Okay, I think I deleted the other ones. But let's go to the Play Store. Let me show you how NCLEX-RN Mastery apps, However way you put it, you can get a series of apps that you can choose from that is not paid, that is free. I'll remove the mastery from it. Let me remove the word mastery. RN exam. So this will be a better keyword to use. NCLEX-RN exam app. And it will bring you a couple of them that you can download onto your phone. It says NCLEX-RN exam quiz. You see, NCLEX-RN test prep. Any of these would work. Just don't pay. I love simple nursing. See, this is the one that I have already. I used to have a couple of them. The Sanders NCLEX exam genie. I used to have a couple of them. Yeah. I used to have a lot of them, like about 3 or 4. That I was just every day. I'm someone that is hands-on. I like hands-on. So sitting down, reading a boring book, it doesn't really work for me that much. So the apps and the questions were helping me a lot. All right. Thanks for watching.